Hello and welcome to The Well. I'm your host, Dr. Brendan Arm, doctor of acupuncture and oriental medicine, Chinese medicine herbalist, and founder director of Lotus Integrative Medicine in Santa Monica, California. There's a wealth of health-related information out there, and I'm joined today by this wonderful group of integrative and holistic medical doctors and practitioners to share some of our favorite wellness tips. Please let me introduce you to Dr. Heath McAllister, a naturopathic doctor and registered herbalist, and Dr. Rob Krochmal, a medical doctor and a practicing physician who is board certified in family medicine, nutrition, and integrative and holistic medicine. So let's begin. Today's topic is men's health. Since we have just the guys in today,
Sure.
let it roll. What do you guys
Yeah,
think?
so
Where do we
I think
begin?
it's a great topic because a lot of guys don't really actively think about their health until something's broken. And, most of my patients, probably most of your patients also, a majority of them are women and, very more proactive thinking. And, I used to teach a class called The Green Man back when I was in Arizona. And we kind of took on that, the reasons for why that might be. I think lots of male dominant societies have this kind of like machismo or a kind of cowboy mentality that if it's not broke, don't fix it, and not to complain. We're taught not to complain. Many more. If a little girl gets hurt on a playground, the mother hugs her. If a little boy gets hurt at a certain age, the father's like, oh, walk it off. It's like we're taught to kind of deal with our issues on our own, and that bringing things up or voicing problems might be a sign of weakness. And so there's lots of reasons why this might be. Other reasons might be, let's say it's a sensitive topic like erectile dysfunction, where that kind of strikes at the heart of what a lot of men consider to be their identity, this like male identity, this classic male identity. And so there's a lot of reasons for it, but a lot of men don't come to the doctor, and to their detriment. So the entire class that I taught was about kind of introducing a lot of classically male issues, but then also non-classical male issues, like we can talk about like heart disease, where it disproportionately affects a lot of men more than women. And what do you do about that preventatively and treatment-wise? What are the options out there for men? So Doc Rob, do you have any thoughts right now?
Yeah, no, that's a great intro, and I would just add a couple of things, which is that I think men sometimes can have the tendency to not give themselves permission to take care of themselves, take care of other people. Women can certainly do that too. So honor yourself and give yourself the chance to come get some advice. And from a Western medical perspective, I'd say too that men might think that there's really nothing to offer, or sometimes they're scared about what the doctors may say, and there can be some truth to that. And Western medicine can sometimes have the tendency to just focus on only your cholesterol. When you're talking about heart disease, that may be a risk factor, but you don't want to just go and talk about that and just have the option of either getting a cholesterol medicine or not. And there's a whole bunch more that you can talk about in terms of heart health and overall health. So I think that that's the most important thing to start to think about is in encouraging men to seek health, is that there are other options that are there, and you and Dr. Arm certainly are representative of the type of healthcare practitioners that men would find really valuable to come to see.
From a Chinese perspective, I talk about Jing cycles. For women, it's every 7 years they, go from one Jing cycle to the next. So it's almost like different chapters in the life. So for the first 0 to 7, and then maybe 7, 8 to 14, and then like 15 to 21. That's more for women, they say. But for men, it's an 8-year Jing cycle. So 0 to 8 is one set or one chapter, and then there's like that 8 or 9 till about 16, and then till about 24, 32, and so that 40 into 48, you see that kind of andropause time, where there's a lot of transformation that happens over a long period of time. So, I have also personally felt, around age 40, you feel like a little bit of transformation, and it doesn't happen overnight, but it might happen over months or even a few years, just like a change of your interests, your identity in a different chapter. So, for the men out there, it might be interesting to think like whatever your age is, are you kind of that 8, 16, 24, 32, 40, 48, et cetera. It might be different chapters of your life. And in different chapters, we like to do different things. The second comment I was going to make was that, I noticed from my own children, because I have a boy and girl, small kids, like I noticed, and this isn't, my sample size is small, but it's just still my observation. The girls at younger ages, they tend to congregate and they talk about stuff. And the boys tend to, get together and they wrestle, and they get physical. So, I mean, what do you guys think about the perspective, the girls are more maybe a little until, the cognitively they want to talk about and share things, whereas the guys, the way they share is in that physical touch or that movement.
I mean, honestly, I think a lot of that's cultural too. I mean, I don't know how much of it's a learned behavior and how much it's the fact that men make testosterone. I mean, I've known some like really passive, sensitive men and boys, and I've known some really aggressive, like brutish women. So I don't know. Like, I think part of it's cultural. I think there's definitely a hormonal interplay, but is it a nature or nurture? I don't know. I think if you went to like a traditional African culture, you're going to find a lot of different expression. And if you went to a traditional, a native culture, Australian Aboriginal, like how is that different? We have Western society and how we've been programmed from television and schools, but how would people exist in a state of nature? I don't know.
Mm-hmm.
I mean, clearly men have testosterone so they can get bigger muscles, and then therefore it makes them natural, like to do the hunting, but beyond that, yes, physical activities, but, preventing them from expressing themselves. I don't know.
Well, I'll chime in one other thought I had, especially since on the conversation of men's health, it makes me reflect back when I was having my first of two kids, there was a men's group that was, available to all the to-be fathers. And I didn't really know what to think of it or even know if I was really interested in it, but I gave it a try. And, in hindsight, I thought it was so helpful. So I think in men's health, if they're able to find some type of community to go, in regardless of what they're going through,
Mm-hmm.
It could be, different stages of life, like, going into fatherhood, or it could be, for more elderly community, working with, men who, are doing more, brain exercises and things like this. I know my stepfather, my own father, they find a lot of value in community and classes that are geared towards stimulating the brain and brain activity and art. It can be very helpful for brain activity for, aging men too.
Yeah, I think the concept of like having a group, Brennan, it's like empowering you to explore different things that you might not normally explore. So that could be, engaging in different activities, but also voicing your feelings, like, knowing that you're having a shared experience is empowering to, dispel embarrassment and shame. If people are struggling with different things, I think the concept of a men's group is great. I don't think we really do it. When I traveled through Europe 25 years ago, 30 years ago, there were these springs in Hungary where men would congregate. It was like segregated, men and women, for better or for worse, but the men would congregate and they'd play checkers and they'd read the newspaper and they'd talk. And I don't really feel like we have, aside from sports, we don't really have like culturally acceptable times that men congregate. Sports and like drinking beer. We have those two things, but like, to talk about feelings, to talk about your experiences and in a really open way, authentic and open way, I think that would be fabulous.
There's a funny, like John Mulaney sketch. He was like hosting SNL some time back, and he makes this comment that his father didn't have friends, and then he points to the audience and says, "And your father doesn't have friends, and your father doesn't have friends. Your father's, maybe the wife has friends, and the wife's friend has a husband."
Mm-hmm.
And that's who they hang out with. So I do think it kind of is funny, but it's also, there's some truth in it and some sadness to the fact that, there's a lot of times I think that men's health deteriorates because they don't have connections with other men. It's a rare thing, and it's something that does need to be nurtured and worked on. And I do try, for example, in myself, every Sunday morning, go play tennis with another guy, because I think that's important for my health and well-being. Yeah, I mean, I'm sure supplements and all these things that you guys have a lot to say on, but even just from a holistic perspective of making some time each week to hang out, not with necessarily your partner, but with other, male friends.
Mhm. Totally.
Dr. Rob, any insight?
Yeah, no, I think you guys are talking about a lot of really important issues, and I think there can be an aspect of even shame to a certain extent that um, that we might feel that it's not okay to express ourselves or to hang out, and that might be partly because some of the venues that we have are not, you know, necessarily the most healthy or representative of the full spectrum of, what we as males have to offer. And so again, that goes to being able to, if we go back to the testosterone issue, there are some aspects of testosterone um, that may create a tendency for men to need to, blow it out more. So do we go on a bigger run? Do we go deeper into the woods in nature and that kind of thing? Maybe to some extent. Again, there's that's a generalization, and there's some men that don't feel the need to do that, and some women that would certainly do that. But finding a way to really express our maleness at the same time as expressing our feelings and the love that we have.
Yeah, I think I mean, we're multifaceted creatures, as equal to women. Men and women are completely equal. We have slightly different experiences, but that's also your culture, your microculture, your specific demeanor. I mean, the things that classically get pigeonholed as men's health is like low testosterone, which, Brendan, you brought up the term andropause, and that's not really a discrete time period like it is for women, but it's a general slowing of hormonal output. And that can affect men in terms of their mood, their libido, their energy levels, and so forth. That's considered to be a male issue. But if we only talk about that, then we're missing all these other things that we could explore in terms of, improving someone's vitality. Prostate issues are the same thing, where people think like testosterone and prostate, right? Yeah, prostate issues are issues. When you have prostatic enlargement in your later years, and every man's going to experience this. Every man, if you live old enough, you will experience enlargement of your prostate. It's a very hormone sensitive gland, and it surrounds the urethra. So when you have an enlarged prostate, it clamps down around your urethra. Men classically get dribbling or hesitancy or urgency to use the restroom. And then prostate cancer, which is a totally separate thing, where you actually have a malignancy in your prostate gland, but it can produce some similar symptoms. Like, yes, those are important things to talk about. But if that's all you're talking about, then you're missing all the risk factors for heart disease, like Dr. Rob was talking about, that, cholesterol, taking a statin drug or not, shouldn't be the only option if you have cholesterol problems or if you have risk factors for heart disease. Looking at weight, looking at blood sugars, looking at, are you a smoker or not? Those are huge risk factors for heart disease, and heart disease is one of the biggest killers for men. So I think that, beyond, we have the mental emotional aspects, but then we have the purely physical aspects as well. And all of it kind of tends to get neglected in men, and men neglect themselves. And a lot of times when men come into your practice, it's because their wife's already been to see you. I mean, I think the culture is changing somewhat in the terms I've seen younger men be more proactive in their health. It's not as taboo for younger men. I think it's a generational thing. I think the baby boomers really struggle with this, where they're the guys that don't fix it until it's broken, and then they come into you and they're really in dire straits. Whereas younger guys kind of see the value of health. There's more of that, kind of metro mentality, that they can be sensitive, emotional. It's not as taboo to be overt with your feelings, which is fabulous. So, of my male population, I have much more younger men, and then I have some older guys with stuff that's like, end stage, where they have diabetes or, enlarged prostate and so forth.
I would add also, just nutritionally, there can be some differences as well. I have a lot of men in my practice that eat. Some of them are the cooks in the house. Some of them are not necessarily. But and again, it spans the spectrum. But I think men can have a tendency to need more protein, for example, need more frequent meals that may have red meat in it, and oftentimes the men just kind of fall into the into the flow of what some of the other members of the household are eating, and can be more vegetarian or lighter and don't necessarily feel satisfied, end up eating more carbs, more sugar because of that. And so again, just giving permission to find your own nutritional needs as well, which may be different in that you don't necessarily need to eat the exact same thing that the rest of the family's eating.
Yeah.
Mhm.
And lastly, I'd point out the stress and anxiety and depression that both genders are especially well, throughout the whole world are struggling with. I see a lot of men coming in of all different ages with stress, anxiety, and depression. Um, so, I mean, the cause of that can be so many things, but the cure to it can be related to connecting more with nature, connecting more with themselves, doing meditation practices, doing more things for mindfulness, breathing, things just to become more centered so that our energy isn't so fractious and scattered all over the place. And then that leads to things like the stress and anxiety. Or the stress and anxiety could be a result from a sleep disorder. So if you're not getting enough restorative rest, try to figure out some evening ritual so that you can get to sleep and you can fall asleep with less trouble, less difficulty falling asleep, and also work on things to help you with difficulty staying asleep. And maybe that can be through nutritional supplements or working with a healthcare provider, or again, just more mindfulness practices of mindfulness eating, mindfulness breathing, meditation, maybe first thing in the morning, things like this to help with the stress and anxiety, which may help the sleep, which may help furthermore the stress and anxiety and depression. Just a couple of thoughts I
I
had
would
on.
also say on that, making like a little dream board,
Mm,
like maybe once a year, checking in with yourself in a really deep way. Are you living in line with what you really desire, with what fulfills you? Because a lot of guys take the identity of being a breadwinner on, like I'm a moneymaker, right? I'm a money machine, and like you may not be happy being that in that role or that particular occupation you chose, even though it's lucrative. Like, are you fulfilled? I mean, I've had many jobs before I became a doctor, and nothing fulfilled me like being a doctor does. And so I was never really happy. And luckily I found what I really wanted to do. But let's say it's 10, 20 years has gone by and you're just chugging away at a job that you're not really fulfilled by. So I think having that honest check-in with, what do you want? Like, not what society, what your family, like, what do you actually desire? As crazy as it might be, just put it down on a piece of paper and
mhm,
like see what kind of connections start coming, see what starts manifesting for you.
mm,
So, that's to try and avoid the kind of off the wall midlife crisis that guys go through, where they get divorced, they get a Ferrari and a hot babe girlfriend, and like they're just out of balance at that point. They're just trying to correct some imbalance that they created.
mm,
And so I think you can live a life that's in line with what you really feel is important for you, but you have to make an effort, and you have to take your life back by take the reins.
mhm. I think the dogs are totally agreeing
The
with
dogs
everything.
agree.
They know, they know. Well, that's all the time we have today. If you have a topic you'd like to learn more about, let us know with a comment on social media. And also don't forget to subscribe to our The Well YouTube channel. Thank you for joining us, and please join us next time for more wellness tips. Remember, regardless of where we are, our resources in The Well are limitless.